I'm Dr. Kumar Gubbala. I'm a senior consultant gynaecological oncologist at Apollo Proton Cancer Center, Chennai. Today we're going to talk about ovarian cancer, its symptoms, diagnosis, treatment, and if it could be prevented, how we could prevent it. The female reproductive organs consist of two tubes and ovaries, uterus, cervix, and vagina. Any cancer developed from the ovaries is called ovarian cancer, or it could sometimes develop from the fallopian tubes as well. The ovaries release egg every month in reproductive period of a woman. In majority of the cases, we don't know the cause for ovarian cancer. Sometimes it could be inherited with a faulty gene, which are mutations in a particular variety of genes, which we call it BRCA1 and 2. This consists of around only 20%, but majority you don't know. Age itself is a big factor. Being older than 60-65 years is a risk factor for ovarian cancer. The symptoms of ovarian cancer are bloating, abdominal pain, abnormal vaginal discharge, vomiting, any change in bowel habits, or you feel yourself full after eating. These are the most commonest symptoms you have with ovarian cancer. Gene is any hereditary element in the body is called a gene. The two varieties of genes that are of more interest in ovarian cancer is BRCA1 and 2. These genes are actually tumor suppressor genes. If there is any mutation among them, then it could lead to ovarian cancer. You're prone to developing ovarian cancers, and 20 to 25% of the ovarian cancers are related to gene mutations. Any of your family members are diagnosed with ovarian cancer, they have to get tested for a gene mutation which is called a BRCA1 and 2. This could be tested either with a blood test or from the tumor. What is inherited is the mutations within the blood. These could be tested from your hospital, or there are support groups which does the testing for you. If you have these mutations within the tumor and not in the blood, these doesn't get carried to the next generation. A patient presents with any abnormal symptoms, bloating, or a cyst found on a routine scan, or having vomiting, or change in bowel habits, or having abnormal uterine bleeding, you need to get to see your doctors. It's usually diagnosed by doing an ultrasound scan, or a CT scan, or an MRI scan. And then the final diagnosis is made at the time of operation, or with a biopsy, which is called a histological diagnosis, where you look at a tissue under the microscope. Staging of ovarian cancer is by two modalities, one by imaging, two by an operation, and histological staging. So if the cancer is spread from the ovary to other parts, it's called an advanced stage. If it is confined to the ovary, it is a stage 1. It is gone to the organs in the lower part of the tummy, it is a stage 2. It is spread to other parts within the tummy, it is a stage 3. If it has spread to the liver, spleen, or other parts of the body other than the tummy, it is called a stage 4. Early cancers are treated by surgery, and you may need chemotherapy if it is spread to the other organs in the tummy. If it is an advanced stage, you might need chemotherapy at the time of diagnosis, followed by surgery, and then more chemotherapy later on. Yes, there are different types of chemotherapy for ovarian cancer. The type of chemotherapy depends on the type of cancer and the stage at which it is presented or as the cancer comes back. All these put together, we will make a choice of what chemotherapy you will need. If you've inherited BRCA genes, then you need to see your doctors for your routine screening for ovarian cancer. Usually it is given in the form of an ultrasound scan and a tumor marker test. Being pregnant or having children prevents ovarian cancer. Today we have discussed about ovarian cancer. If you have any bloating, change in bowel habits, or any abnormal bleeding, please go see your doctors to get tested for ovarian cancer. Stay safe, stay healthy, stay informed. If you have any of these symptoms, please go see your doctors.